Hi, my name is Dr. Karen Semmens. I am part of the Dakota Geriatrics Workforce Enhancement Program. Along with Dr. Chris Hendricks, we have developed a series of micro-lectures on the age-friendly concept of the 4Ms. The 4Ms are the mind, medication, mobility, and what matters most. This presentation is focused on the mind. This presentation is Alzheimer's disease. The objectives for this presentation are to identify the cause of Alzheimer's, recognize the four main symptoms of Alzheimer's, understand its stages of Alzheimer's, and identify various behaviors and treatments for the behaviors. Alzheimer's disease is the most well-known and common type of dementia. What causes Alzheimer's disease is there's an abnormal deposit of proteins from amyloid plaques that are built up in the brain. These proteins cause tangles, and they form throughout the brain. And it's kind of like if you think about a highway or an interstate, and you have a detour, and you have to detour off of the interstate onto a side road, on that side road to another road, and to another road, because there's a blockage. That's kind of what happens with the plaques, is that they cause plaques that form throughout the brain, and the information cannot get through those neurons. The information doesn't get through the neuron, then that neuron dies, and everything behind that dies. So there is actual brain death that does occur with Alzheimer's disease. The onset is usually in their mid-60s or older. This is a disease of the aging, so the more older you get, the more chance you have of developing Alzheimer's disease. The progression of Alzheimer's can be as long as 15 to 20 years. The 5 A's of Alzheimer's are amnesia, aphasia, apraxia, agnosia, and atypical depression. Amnesia is memory loss. It's usually the most visible and common sign that there is something wrong, that the person is not being able to remember things. Aphasia is when there's an impaired part of communication. Communication is production and comprehension. So production being I'm thinking about what I want to say, and comprehension is understanding what other people are telling you. There can be a breakdown in both of those or one of those, but it can cause some difficulty with communication. That's called aphasia. Apraxia is impaired voluntary motor skills. Might be some shaking, maybe some inability to hang on to things, can affect their balance, can affect their ability to know what to do with the washcloth when they're bathing. So apraxia is impaired voluntary motor skills. Agnosia is the inability to receive or correctly understand information from the senses. So hearing, maybe not hearing things very well. The smell might be affected. Tastes, sometimes when I've worked with people with Alzheimer's disease, they prefer sweet things over sour or bland things. Not a big fan maybe of the mashed potatoes anymore, but you put something sweet on it, like chocolate syrup, and the potatoes taste much better. Touch and vision. So we want to be sure that the person who has Alzheimer's has their hearing aids in, if they have it, that they have their glasses on and the glasses are clean. The touch sometimes is if you put something in the person's hand like a pencil and you ask them to feel it, they can't feel that it's a pencil. They might not be able to see that it's a pencil, so they can't recognize what's in their hand. They also are unable sometimes to recognize loved ones, and that can be very difficult for the family, is that they don't recognize that loved one that comes to see them. Oftentimes we will see that the person that has Alzheimer's, as they kind of go back in time, they might not recognize themselves as being 85. So if their daughter comes in and comes to see her father who has Alzheimer's, and their daughter comes in and the daughter is maybe 45, and the person with Alzheimer's thinks they're 45, this can't be my daughter, this must be my wife. So maybe the daughter becomes the wife, and the grandchildren become the children, because in their mind, that's where they are in their stage of their life. So it is very difficult for the loved ones to not be able to have their husband, wife, father, mother recognize who they are. Atypical depression is one of the other, is the last 5 of the Alzheimer's symptoms, I guess. Atypical depression is different than regular depression. What we'll see with somebody who has atypical depression with Alzheimer's is that there is more agitation, there's anger, and there's annoyance, and there's aggression. And these can be difficult because these are some of the behaviors that we'll see as the disease progresses. And those behaviors can be difficult to handle and to manage. There's stages of Alzheimer's disease, and you can see different stages and different things that you listen to. This presentation, we're going to talk about the 3 stages. So the mild stage is word finding difficulty. And sometimes this is like the first thing that people recognize. Now, there is a part of normal aging where sometimes we can't remember what we're going to say, but we think of it later on. With Alzheimer's, not being able to find the right word. Remembering names when introduced to new people. Difficulty performing routine tasks at work or in social settings. Starting to have more problems if they work at the bank. They aren't able to count out change anymore. They're in a social setting, such as going to maybe to play bingo or going out to eat. Not remembering what utensil to use. Not remembering how to play bingo, even though it's something that they've done routinely. They might forget what material that was just read. You might ask them to read a paragraph in a book or a paragraph in a newspaper, and they can't recall what it is that they just read. Losing or misplacing a valuable object. So many times we will tell family members not to leave the valuable objects laying around because they might get lost. They might get thrown away. Even dentures might get thrown away in a napkin. And then there's trouble with planning and organizing. Those are some of the mild symptoms of Alzheimer's. In the moderate stage, this is usually the longest stage. You might start seeing that the dementia symptoms are more pronounced, having more confusion with their words, getting frustrated or angry for no apparent reason. Some of that atypical depression behaviors are going to start up. Kind of starting to act in unexpected ways, refusing to bathe. Forget events or personal history, might not recall where they went to school when they were younger, might not remember anniversaries or birth dates, unable to recall information about themselves. You might ask them what their address or their phone number is, but they don't remember exactly what it is. They might give you a phone number from the past or their address when they were a child. Choosing improper clothing for the season or the occasion. This can be difficulty up in the Midwest, in Minnesota, North Dakota, where I'm from. Can get very cold in the wintertime, and the person might not put on a proper jacket or boots or something. So we worry about them wandering outside and possibly freezing to death. There is changes in sleep patterns. They might either sleep a lot or they might not sleep at all. This can depend on sometimes the type of dementia that they have, but for Alzheimer's also it is a problem with sleeping. Incontinent of bowel or bladder. When the person becomes incontinent of bowel or bladder, this is usually the time when the caregivers are going to start needing some help. Or this is when they might start thinking about, I can't take care of mom anymore. She's getting up in the middle of the night. She's, we're having accidents and having to change the sheets in the middle of the night. This might be when they start looking at placement or getting someone to come help. Wandering or getting lost, not remembering how to get home. This might be a time when you might start taking away the driver's license because they don't remember how to get back and forth or the keys to the car. Some personality and behavior changes, and this can be difficult for the family members also, that they become suspicious that they've lost their purse and they're accusing the family member of taking it. There can be some delusions, some compulsive or repetitive behavior, and you might hear this. They might ask the same questions over and over again or do the same tasks over and over again. The severe stage is usually when they require round-the-clock care, either round-the-clock care at home or being placed into a facility. At this stage, they lose awareness of surroundings and any recent experiences, changes in physical abilities such as walking, sitting, and eventually swallowing. Might have to have the diet change so that they're not choking on food. They might have to go to more of the parade or the very soft types of food. Might not be able to walk anymore, so they'll have to be transferred from a sitting position to a lying position. A lot more difficulty communicating and becoming more vulnerable to infections, especially pneumonia. And that would possibly be because if they're having difficulty walking, they tend to become more bedbound, and as the disease progresses, they don't take as many deep breaths as they might, so pneumonia can set in, and sometimes it's a respiratory infection that does cause a person to pass away. Some of the behaviors that we'll see with someone with Alzheimer's, and this is going to depend on the stage of the disease. So as we saw earlier, that the stages can last for Alzheimer's from 15 to 20 years. Starting to see the difficulty with word finding maybe 15 years ago, and this is where it's important to go back and ask family members, when did you start noticing that they were having some more confusion? When did they start having more difficulty communicating? As the disease progresses, the behaviors might change. And some of the behaviors that we'll see are physical behaviors, that aggression that we talked about. They might kick or hit, punch, pull your hair. There's some spitting and biting that might go on. And this is because they might not recognize the person taking care of them. And it causes them anxiety, and they're trying to protect themselves. Verbal, screaming, yelling, insulting. Again, not knowing who the person is that's taking care of them, trying to yell and tell them to get out of their room. They can be insulting. There's not a filter sometimes, and they say what's on their mind. Sexually inappropriate behavior, might have some improper behavior in public, might undress in public. They might make unwanted advances towards other people. Like if they're in a long-term care facility, they might make advances towards other residents or staff members. One of the things that we have to remember with any type of the behaviors is not to take it personally, because it's not directed at us. It's part of the disease. The treatment that we're going to do for someone with dementia is going to vary on the stage of the disease. Some of the non-pharmacological or non-medical or medicine treatments that we can do is reality orientation. In the beginning of the stage of the disease and they can't quite remember where they are, it's okay to say to them, today is Groundhog's Day, or today is Valentine's Day, or today is Christmas. But sometimes we don't want to say, well, you remember, Mom, it's the 14th of February, it's Valentine's Day. Doesn't make it any easier for the person, because sometimes they know that they're forgetting things. So, today's Valentine's Day, it's the February 14th. Many times when I'd go in and visit with somebody who has the early stages of dementia, I'd say, hi, my name is Karen. And boy, it's a beautiful day today. It's February 14th, which, boy, that's today's Valentine's Day. So I will give the information without making them feel like they can't remember. Reality orientation works fine up until a point where it starts to agitate. So if the person feels like, geez, I have to get home right now. It's 3 o'clock. I have to get the kids off the bus. Well, their children are grown and have children of their own. If you start to argue with them and tell them, no, you don't have children that are getting off of a bus, what's going to happen is you're going to have the person's anxiety level go way up, because they're thinking, well, gee, who's going to get my son off the bus? Who's going to get my daughter off the bus? You tell them they don't have any children getting off the bus, they're going to start to worry. So then we switch from reality orientation to what we call validation therapy, where we kind of go back in time with them. If they are thinking that they're back on the farm and they have to go to town to get their kids from school, or the bus is coming to see them, talk about that. Boy, what's it like on the farm? What did you do on the farm? So you go back in time with them and you validate where they are in their time of their life. We want to simplify the environment. If they don't remember how to use a remote control on their TV, then remove it. Get rid of the remote control, get rid of the TV if it makes them frustrated. Communication. We want to communicate with simple words as the disease progresses. Don't give long, complicated commands or directions. If I wanted someone to brush their teeth and they were in the later stage of the disease, I would have a toothbrush in my hand and I would tell them brush, and I would have them mimic brushing their teeth with me, but I wouldn't give long directions. I would just say brush and then spit and then rinse, whatever it is I wanted them to do. Make sure that they have their sensory aids, that they have their hearing aids if they need it, their glasses, and make sure that they're clean so that doesn't interfere with any of their inability to understand us. Some of the pharmacological treatments, again, is going to depend on the stage of the disease. For memory impairment, these 4 different types of medications are what you often will see. Aricept is probably one of the ones that's the most common that you hear, and it's not unusual to have Aricept and Namenda given at the same time, or Exelon and Namenda given at the same time. Just depends on what is working for that person. One thing to think about with these medications is if you start them earlier on in the disease, you kind of want to continue it until it gets towards the end of the disease. Because if you do stop it, their ability to remember will decrease to where it would have been without the medication. So we want to keep those medications on as long as possible. So those medications are for memory impairment. Sometimes for behavior management, we want to try maybe some anti-anxiety medications, but we have to be very careful that we don't give them medications that cause delirium, because that will increase their behaviors. So some antipsychotics sometimes are given if the person has hallucinations or are becoming very very aggressive to help calm them down a little bit. And then some mood stabilizers, which sometimes are medications that they used to use for seizures, which will kind of help control that person's mood. Sometimes there is some depression. We talked about the atypical depression, so we would give an antidepressant to help with that. So there can be a combination of medications that are given. Okay, so here's our case study for someone with Alzheimer's. We have an 82-year-old male. His name is Carl. He was admitted to the skilled nursing facility. He has been living at home with his daughter and her family for the past 2 years. The daughter states that her father has been progressively getting harder to care for. He's become more aggressive and suspicious. The daughter reports that her father has been wandering outside in his pajamas and slippers. She is worried that he will wander outside at night and freeze. He has lost control of his bowels and bladder. The daughter states that she can't care for him safely at home anymore. So here's some questions to think about. What stage of the disease do you think Carl is in? Well, he's moving more towards he's out of the middle stage. He's moving more into the severe stage where it's harder for the family to take care of him. He is becoming incontinent of bowel and bladder, and he's starting to wander. So he's in that end of the moderate, beginning of the severe stage. What interventions can we use when Carl starts talking about living on the farm and that he needs to feed the cattle? If that's where he thinks he is, we're going to go back in time with him, and we're going to talk about living on the farm. How many cattle do you have? What do you feed the cattle? Well, what time of the day do you have to get up? Those kinds of things. So validate his feelings, and it's also a good time to do some of that reminiscent therapy and talk to him about what it was like when he was younger and living on the farm. Okay. So that is the end of this presentation. Here are our references that we used for this presentation, and we sure appreciate your listening and participating in the case study. Thank you. Goodbye.